Hey everybody, welcome to Regulatory Joe. I'm Joe Boyle, the President of Regulatory Solutions here at Penstock, and today's topic we'll be discussing network adequacy and what's changing in 2025. Network adequacy inherently is establishing time and distance standards to primary care physicians and specialists within a certain state or geography, generally speaking a county or zip code level, to ensure that members that a health plan serves within a state can access care quickly and compliantly. So when we talk about what's changing for network adequacy for 2025, there's a lot that we can look forward to, starting with some of the operational activities that need to occur from a filing perspective. First and foremost, when CMS released the network adequacy templates for 2025, they did release it with new guidance. Some of you may know who are close to the work, who have done this year over year, may have noticed that last year, the network adequacy template was combined with the ECP, short for Essential Community Providers template, into one Excel file document. It's really important to know because for the 2025 plan year, CMS has removed the ECP portion of the adequacy template and has made that into a separate document that is now on the web. It's changed the operational process of how a traditional filer will then receive the data and complete the population of this document that already is highly complex. And by doing that, we encourage folks to understand the new business process put forth by CMS, read the instructions on how to actually aggregate your providers by time and distance, and run validation checks, pre-submission, during submission, and post-submission. Some of you, based on what states you participate in and where you play, may have already validated your templates, but make sure that you're inputting all the ECP providers within the application in HIOS quickly, early, so that they can link the application appropriately. Second to some of the operational activities that have updated for 2025 is quantitative time and distance standards. Quantitative time and distance standards really pertains to how the data is aggregated that's placed on the templates that are filed. Generally speaking, health plans behind the scenes have programs to aggregate provider data in certain formats that are desired by divisions of insurance. We need to quantify that data more so that the measurements and the analytics of time and distance standards is more clear for CMS to satisfy gaps with adequacy. So it's really interesting because when we start looking at the turnover rate and the churn of providers within a specific network, we start to think about how we should track that. So CMS is clearly pushing to have more quantitative tracking for carriers, but what does that actually mean? The more established carriers that have a bigger presence in the marketplace will have more resources and tools and frankly capabilities to track this quickly without a burden to the business. But when you look at smaller, more regional carriers or startup plans, they may not have all the capabilities or the resources to aggregate this data in a quantitative way. The way we look at the new proposed rule is, as this is rolled out and deployed this year, 2025 and beyond, is a struggle with carriers aggregating accurate data to be filed on or off the exchange. And network adequacy being one of the most highly complex templates and data sets that health plans have to file, smaller carriers may struggle greatly with actually ingesting this data or even having, frankly, the amount of time or resources available on staff to input correctly into the federal templates. Now, what I recommend is, as you're going through this process, be close with your CMS account manager, be in lockstep with where you're at in the filing submission process to reconcile errors quickly as you're submitting and validating, and also cross-validating in HIOS. Make sure all your ECPs are loaded in very timely to make sure that they're ready for validation. What we're recognizing right now is that with the split of ECP out of the adequacy template, we do see or anticipate that CMS will start to bring more adequacy rules up onto the web from the Excel template. So would not be surprised if we start to see a trend in terms of automating more of this down the road. We do think that issuers may struggle with aggregating the data quantitatively, even if it's in the for benefit of the filing process, ultimately speaking. So another key item, part of network adequacy changes for 2025, is county level standards and justifications. And it's really important to understand this piece at a high level, and then for some of the operations folks out there or network specialists, definitely at a lower, more granular level. Generally speaking, county level justification standards are a way that CMS can track and monitor how carriers build their network, sustain their network, and expand if they're looking to expand within a state or a net new market in general. The reason why we're putting a focus on county level justification standards is because network data can be aggregated in many different ways. You can aggregate network data by metallic tier, so that would be by the level of plan that you offer in the marketplace, whether it's gold, silver, bronze, expanded bronze, or even platinum, even looking down to the federal standard variants that CMS has put forth as well. You can also break down your network by zip code or county, for specific counties that you're entering, if you're doing a statewide network versus a partial county network. What's really important about this is, based on how you aggregate your data, sometimes gaps can be produced, requiring a justification. CMS has recognized that after many years, issuers have gaps with adequacy, and a way to solve those gaps is by producing a justification. Having county-level justifications will allow issuers to enter markets to offer health insurance to people that need it the most without holding them back, operationally speaking. Acknowledging that the process does have opportunity for improvement, we do expect CMS to start strengthening these rules and also increasing the reporting enhancements. We encourage smaller issuers just to look out for this, because from your capability standpoint, it may be harder for smaller carriers to adapt to these new rules. For larger carriers, this could be accelerating their competitive advantage in the marketplace as well. So the next big topic for adequacy for 2025 is provider telehealth status. Now, we do know that since the era of COVID, that a lot of care has been moving to a virtual setting. And since then, CMS has asked issuers to provide and or furnish a level of that data to dictate a provider's telehealth status. Provider's telehealth status is an indicator when a member enrolls into a qualified health plan that tells them if the provider offers virtual care. Right now, it's really hard to collect this data. Contrary to popular belief, you would think it would be readily available on aggregate or the quantitative data reports that are already available within a health plan. But what we've seen across the country is that health plans have to manually reach out to individual providers, not just hundreds of them, but thousands of them, whether it's through a flyer, an email request, or a phone call, even manually trying to figure out if a provider offers telehealth on their website. Would encourage everybody, based on how you get your network data aggregated today internal to your health plan, to, even if it's not required for your issuer or your states have not asked you to furnish this data, for you to actually proactively start to develop a process with your network team or your contracting team as an indicator to actually try to track the status of your providers for telehealth availability. So that being said, doing this exercise proactively to get ahead of new rulings will save a lot of time for your resources and staff on hand, so you can focus on more strategically driven priorities. For anybody out there who's completed an on-exchange or individual qualified health plan filing, you are most certainly familiar with network justifications. Maybe this is your first time going out into the marketplace or filing on or off the exchange. Network justifications are a fillable PDF form field that helps health plans justify why there may be an adequacy gap. What is an adequacy gap? This would be a gap in a network that dictates that a health plan does not have a contract with a required specialist or required provider for that network. So justifications are generally required when a health plan is not able to meet certain criteria for providers or specialists, or does not have the amount of specialists or providers available for a particular type of service. For example, we all know that there's many types of primary care providers, or PCPs. You have family providers, you have children-specific providers. For specialists, you have everybody from chiropractors down to physical therapists, occupational therapists, or even speech therapists or pathologists. Why is it so important, and why are justifications even needed? Well, depending on the geography of a state, if you have a more rural state and not a metropolitan area, or like a downtown area city where you have many providers in a conglomerate location, health plans may struggle to contract with rural providers that are spread out across a state. Health plans need to be proactive to actually strike up those relationships as early as possible, because we estimate that it can take up to 12 to 18 months to contract an actual compliant network for any type of market expansion or new market entry. We recommend to start the provider process early to develop those provider flyers to actually touch and set your rates and make those contracts as quick as possible to ensure that no gaps are made. And if you can't fill all the gaps prior to submission, and if you do end up submitting your network adequacy to CMS with gaps, we need to make sure that you have justifications completed quickly and ahead of time. Generally speaking, network justification would be completed by somebody at your organization in a network leadership role, or even as far as a legal role, to make sure that it's signed off on, that the county level or provider level specific information is attested to and submitted to CMS with a reason as to why a gap cannot be made. If no providers exist in a certain geography, then there would be nobody to contract with, therefore leaving a justification, a valid reason for completing the submission. So another reason why a health plan may need a justification is due to a facility having a headquartered location in one state, but subsidiary locations in other states that may be outside of the network that you originally were looking to contract. For example, if you're entering one state in one marketplace, you could have a large hospital system with satellite locations in a bordering state next to your state. So a network adequacy justification could be needed to cover those gaps that are in network and or out of network. Completing these justifications may need resources in your health plan team that require network leadership, legal, even government affairs. But rest assured, as you make these changes, make sure you keep your filing team and your product team informed so that they know how to make the necessary updates underway and submit things timely. Generally speaking, justifications come with deadlines and target due dates from CMS or DOI. So you just want to make sure you're understanding the timelines that you're up against as you're going through the review process. When we talk about network adequacy certification and reviews, there's a couple considerations that we need to think about. Now, this is the first year in 2025 with the new standards where the ECP portion of the template has been removed from adequacy, meaning by this point in the year, your operations team should have already inputted all the ECPs manually within the HIOS application, as well as validated and finalized your adequacy Excel template. Now, once that's exported to your XML and validated in SURF, regardless if you're a state-based exchange or a federal marketplace, start the review process as early as you can. So even if you miss the early bird deadline, or if you're working towards the application deadline, later in the year, try to submit as early as possible because adequacy will take arguably the longest time for the regulators to review. Just a few nuances and a few differences between the two. If you are a state-based marketplace specifically, we encourage you after you submit to strengthen your relationship with your regulators to ensure a mutual review is occurring, to ensure that if you do have gaps that you need to justify, that you can discuss them and complete them and close them in real time. Make sure that when you are executing on any changes, if need be, that you resubmit not just to your state exchange, but you're also concurrently updating all the materials and all the functions in the ECP portion required in HIOS. So make sure that always that you're linking your templates on time and appropriately, because the system will recognize if you have not updated both when one change is made. Understanding the nuances between the SBM and FFM will be very important because you definitely do not want to be at the 11th hour of a deadline or 1 p.m. on June 12th when CMS closes the gates and you haven't linked a template properly. So when we talk about impact analysis, there's a couple different things that occur here. Internal to a health plan, we need to make sure that a couple different functional business areas are informed during network adequacy review and certification. This could be inclusive, but not limited to your government affairs organization, your network operations team, your network strategy team, even down to your product team or benefits team. So you may be asking yourself, well, why all these people are impacted? Well, as we know, a lot of the data that is approved and certified on the network adequacy template can also be found in other templates within the CMS template suite owned by different business owners within your health plan. That being said, if there are network gaps that you need justifications for during the review process and changes are made, if you do not have a work group established already to your plan, we recommend you set one up and establish that quickly. Once you have your stakeholders internally identified, definitely make sure and cross your T's and dot your I's that all those dependent documents outside of the ECP and network adequacy portion of the templates are identified and updated, and make sure your versioning control is ironclad. If you don't have a change governance process by this point, it'll be really important to establish one quickly, as we do recognize that it's hard to keep track of all the CMS federally required documents and all the state-specific supporting documents that carry components and byproducts of this data. So I think there's a lot of takeaways of what we can look forward to, not just for this year, but multiple years to come, because as we're looking at how CMS is changing the policies and procedures around network adequacy, we do find that the proposed rules and the rules that CMS is putting in force right now will be ultimately beneficial to the overall process in the future, but there will be some growing pains internally to get there. We recommend that you document some standard operating procedures, identify your subject matter experts, and really record the nuances that you've encountered this year so that you can tackle them seamlessly next year. All these metrics can be measured and to produce measurable analytics for your business, and especially on how your speed to market is working. I think collectively we can all agree that network adequacy is not going away. CMS will continue to strengthen the policies and parameters around it, but in the for benefit of health plans and for the member, ultimately speaking, even if there's going to be some growing pains with the process along the way and some operational nuances, we do see that the process should be getting more clean and more better past the 2025 plan year. We encourage you to look out for the 2026 Notice of Benefit Payment Parameters, get an early look at that, comment on the draft, make sure your voice is heard to CMS so that they understand the issues that you're experiencing, and hearing your feedback. It's going to be really important. The feedback from the smaller issuers versus the larger issuers are vastly different based on capabilities. We need to make sure that you guys have a seat at the table, everybody, for carriers of all sizes, to make sure that the new requirements being released specifically for adequacy are going to be adhered to and that you can actually make it happen. So that being said, really appreciate everybody's time today. Give us a like, give us a share. We'll see you next time.